Hello everyone, magandang hapon po on a Saturday. And sa mga na-isolate dyan, I hope you're leaving the isolation soon or that you feel okay habang naka-isolate. I'm Dr. Anna York Bondoc and welcome po to Libreng Consulta. I myself just got out of isolation. So I hope that you are all well. We are going to be live on YouTube, live po on Facebook, para po makatulong and to give you a chance to ask questions sa mga walang access po sa doktor. Dito na po kayo magtanong. Again, I'm sorry I cannot answer po talaga yung specific talaga sa inyo, no? Pero para matuto po tayo ng pangkalahatan pong dapat gawin habang tayo po ay positive or habang tayo po ay trinatrangkaso and presume to have COVID. So please put your questions below and we will do our best po to answer them. Today, ang pag-uusapan po natin is simpleng gamot para sa COVID. Alamin po natin itong mga gamot na ito. So I prepared a short outline. So ito po. So our question pala comes. Sorry, I forgot the question. From Mina, Dear Doktora, positive po ang aking asawa at 3 anak. Well, actually, si asawa lang po ang positive at yung mga anak, presumed positive na po. Sila po ay linalagnat, sinat lang po, mga 38, inuubo at sinisipon. Ngayon po, sinabi po, kaya naman daw sa bahay dahil mild. So ano po ang dapat naming inumin? Please advise me, Doktora. Thanks, Mommy Mina. And this is a very common question po for everybody.
The bad tasting medicine and the
Yon. Kasi sabi pa lang ho ng anak ko, Mommy, tell them about the bad tasting medicine and the paracetamol. Since kami po ay dumaan din po ng ganyan. So, let's go. Yung guide questions po natin. All right. So, before we go into this, ang pag-uusapan po natin ngayon are the over-the-counter medicine. Ano po ang, I think I gave you to flash over-the-counter, Miss Kat. What is over-the-counter? Okay? Yung over-the-counter po, no? Baka hindi po niya nakuha. I will send it to her again. Over-the-counter. Ayan po. Okay. Yan. Ang ating pong, puntahan muna natin to, okay? What are the simpleng gamot ng COVID? Kasi, before, ito po yung mga over-the-counter, yung nabibili po na walang reseta. Okay? Ito pong mga gamot na babanggitin po natin, hindi po ito mga antiviral. Like, hindi po nila pinapatay yung COVID directly. Unlike yung diniscuss po natin the other day, yun po yung rinereseta po ng doktor. These are the antivirals that are new, one of which is molnupiravir po, no? Maybe you can type that. Yun po yung mga antiviral po. These require the doctor's prescription. Ito pang pag-uusapan po natin are simpleng gamot, no? Simple medicines that are more for the relief po ng simptomas. Ayan, parang lumabas po si molnupiravir. You can show it again. Ayan po. Now we talk about that the other day. Yan po yung antiviral na bago. That's an oral medication. That is prescribed by the doctor for yung mga serious cases, yung mga maraming comorbidities, yung mga matatanda at yung mga hindi bakunado. Okay. So ito po today, pag-uusapan po natin yung mga over-the-counter. These are mostly for the symptoms para sa nararamdaman po nila. And number 2, hindi po nila kailangan na reseta ng doktor. But of course, you have to know what to buy kasi hihingin nyo sa Mercury or sa Watsons, okay? Or sa generic botika. Alright. So, lininaw ko po over-the-counter versus prescription. Yung prescription po requires the prescription pad po at susulat ng doktor. Bakit po tayo, why is it over-the-counter? Kasi po, ang ano po natin is, you can buy it by yourself. You can drink it also by yourself. But please, you read po the instructions. Lalong-lalo na po sa mga bata, be very careful because it is based on weight. Sa mga adults po, you just read the instructions, okay na. But for the kids, you may need the guidance po of your pediatrician kasi po, iba po yung dosage kung sobrang maliit at iba po yung dosage kung talagang 12 or 15 years old na po yung bata. Okay? So by weight po ang mga kids. So let's start. Number one po, no, was paracetamol. What is paracetamol?
Paracetamol po, doktora.
Ang paracetamol po, andito na ba yung babasa? Sure, you can read it, no problem.
Yes po, doktora. Letter A, paracetamol po.
Thank you. Yan po yung antipyretic. Let me type it kasi medyo
Hello po,
mahirap
Doc.
yung
Can you hear me
spelling
po?
yun. Ano?
Naririnig
Apo. Yes, we can hear you. So, yan po, paracetamol is an anti-fever drug or what we call po in medical terms is an antipyretic. Lalabas po yun sa screen. Ano po? When a person gets ill, nagre-reset po yung body temperature niya. It actually comes from the brain eh. Nagre-reset po yung body temperature natin to help us po fight the infection. And that's the reason po na tumataas po yung lagnat natin. And we drink paracetamol. It disrupts one of the processes po and tries to reset us back to lower temperature. So bakit po masama ang fever? The fever gives an uncomfortable feeling. Hindi po maganda yung feeling po na may lagnat. And hindi naman po pwedeng nilalagnat tayo the whole time. So we take paracetamol. I have here some eto po tablets for adults here. Tablets for adults. And bawal ho atang pakita yung brand, so I just show it. Ayan po. Yan, no? Dito po. Paracetamol. Ayan po, no? Here, the brand. Ayan. No brand. So that is for the adults. I'll just go for the adults muna, then we go to the kids, ano? Sa adults po, you can take paracetamol, usually 500 milligrams. So, every 6 hours. So, in the beginning po, we take this para bumaba po yung lagnat natin. You can take it without waiting po for the lagnat to go down. So, you initially, for the first 48 hours, you can take it round the clock, yung sinasabi po nila, no? Around the clock, meaning every 6 hours, para lang po bumaba yung lagnat ninyo. Other things that you can do is to take sponge baths po na maligamgam na tubig and just wear po comfortable clothing kasi pag mataas po yung lagnat nyo, iba ang pakiwari talaga ninyo. Meron pang ibang nagkaka-chills, okay? So paracetamol is one of the basic drugs po talaga used for a wide variety of infections. Please do not take paracetamol do not take more than the prescribed, okay? Kasi may epekto din po ito sa kidney. And, sorry, there's an effect po sa liver. There's a liver effect po this. In fact, there's such a thing called paracetamol overdosage, okay? So just take 500 every 6 hours. Kung hindi po gumagaling, well, then that's the time to call your doctor. Okay? So, this is the one for kids. It comes in a syrup form po. I hope you can see it, ano? Bablock ko lang po yung brands because we're not supposed to show brands. Ayan po, paracetamol for kids. And buksan po natin. Ayan po, no? Here. Man po, basahin ko na lang po. 1 to 5 years, 2.5 to 5 ml, 6 years to 12 years. So by age po, no? Now, it comes with this cap. Okay? Dito nyo po makikita on the side, meron pong 2.5, ayan po, 7.5 and 12.5. So you measure it here and then you pour it into the kutsara kasi medyo mahirap po namang inumin dito. So for the children po, it's by age or by weight and you may wish to ask your pediatrician po, no? Kasi I'm not a pedia, so yan po. So that's the paracetamol for adults and the paracetamol for kids. Again, every 6 hours din ito. And kung napapansin nyo pong hindi bumababa yung lagnat despite like 24 hours of paracetamol, you may wish to consult your doctor. Okay? Lalo na po kung may edad o batang-bata po yung ating pasyente. Okay, next.
Decongestants.
Ayan. Some people like to take decongestants. I'm possibly one of those, okay? One of the most common decongestants po is what we call po, it's a combination drug, phenylephrine and chlorpheniramine. Ito po, no? Yan. Okay? Adults. So, yan po yun. Parang ano po, this combination decreases the stuffy feeling, parang baradong ilong. Ang ginagawa po nito, it causes the blood vessels po na lumiit in your nose, so the stuffy feeling kind of goes down. So, yun po yung decongestant, to decongest. Parang yung pakiwari nyo. Again, symptoms lang po to. This is not to fight COVID, pero kung feeling nyo barado yung ilong nyo, you may want to take a decongestant. Okay? And then, after that, another kind of drug po. The next.
Mucolytic.
Ayan. Ito po yung ambroxol. Ayan. So, here. Ayan. People use mucolytics. Ano po yung mucolytic? Sipon. It allows you to bring out the sipon better. Parang makapal siya. So, lumalabnaw siya with the mucolytic. And it allows you to bring out, habang umuubo ka, mas madali pong iubo yung sipon po na napapakiramdaman nyo pong nandito po sa dibdib nyo. So, lumalabas po yung sipon nyo. So, that is a mucolytic. It's ambroxol po sa, that is the generic name po. I don't mention any brands. Okay? Kids and adults po yan. And lastly, cough medicine. Ito po for adults, we have the tablets. Anyway, I'm mentioning it po, no? Lagundi. Lagundi was discovered, this is from a herbal drug. I like Lagundi actually. Yan po. This is a Philippine product po, no? Yan. Si Lagundi, no? Yan po. Okay. This is a Philippine product. Was developed po at the University of the Philippines by Dr. Professor Emeritus worked on this. Her name is Dr. Nelia Maramba. Okay? So, na po si ma'am ngayon, and she was the one who actually worked to make Lagundi a commercial product. It has become one of the most successful products po out of the University of the Philippines, and it stops you from coughing. Kung grabing-grabe po ang ubo nyo, you may opt to take Lagundi. There is also the generic name po na dextromethorphan. Let me write that down. Ito po, these are cough medicines that pag ubo ng ubo, you may take the cough medicines. So, ito po, these are the, medyo nakakagulat nga lang kasi if you take like ambroxol, para maiubo mo yung ano, it's an X, dextro, metformin, not dextro, D-E-X. Ayan po. Sorry, ako po ang nagkamali sa typing. Yan. So, ano po, medyo nakakatawa po si number 3 and number 4 kasi the mucolytic para lumabas yung mucus. Paano mo ilalabas yung sipon? Through coughing. Tapos uminom ka ng cough suppressant, di ka nakauubo. So, medyo mahirap nga pong tansyahin. So, try to find out, is your problem too much coughing? Then, ano po, you can take the cough suppressant. Kung talaga feeling nyo, ang dami yung plema na gusto nyo ilabas, then you may take the mucolytic. Okay? So, wag na, tansyahin nyo po yung problema nyo. Don't take all of that together. Kung may lagnat, take the paracetamol. Kung baradong ilong, take the decongestant. Kung feeling nyo sobrang sipon, take po the mucolytic. At kung talagang masakit kung umubo, take the cough. Okay? So, these are simple home remedies. And non-medical remedies that you can do po. Ito po, I use this sa anak ko. I hope it's okay to show this. It's not naman prescription. Ito po yun, ano. They put that in the forehead para ho bumaba. Si Benji po likes that. Another thing that you can do, yung suob po or using the nebulizer. Kaya lang, if you really are maraming kasama sa bahay, please nebulize outside. Kasi po, kung talagang positive po kayo, you are spreading the aerosols po. Or at least nebulize with the window open so hindi po kayo kumakalat. So yun lang po, that's the basic po talaga ng mga over-the-counter medicines which you can take po. For the kids, be aware po of the weight and age requirements and consult your pedia. Hindi po ako pedia, so medyo hindi po ako malakas ng loob na magsalita sa mga bata. Consult talaga your pedia. I'm speaking more for the adults, okay? But however, if you are elderly or a senior, number 2, marami kayo sakit, like sakit sa puso, dialysis, asthma, talagang cancer, or grumagrabe kayo while taking these medications, always be ready po and be aware that you may need to call your doctor. Kung hindi po, tumatalab po yung mga gamot. You may wonder why I didn't prescribe antibiotics. Ako po, I don't start antibiotics agad for a viral infection kasi it's not the cure for a viral infection. However, kung nagpe-persist, you may opt to start antibiotics. Again, upon the recommendation po of your doctor, don't start it yourself. So yun po yung simple over-the-counter medications and I hope po nakatulong. Thank you. We're ready to answer the questions. Reina, since may mga positive
Yes
kayo,
po.
what are you using na gamot? Can you make kwento to me?
Sure po, I can share po my experience. Okay, before the gamot, before ako actually as a nurse, doktora, this is my practice. Before ako magbigay ng gamot, I always check what are the symptoms. Ano ba ang simptomas? Kasi baka mamaya, ang symptoms, bigay tayo ng bigay ng mucolytic. Wala naman palang ubo. 'Di ba?
Ay,
So,
true.
bigay ng paracetamol, wala naman palang lagnat. So, kawawa naman si
True.
kidney. Yes. And also, before the gamot, siguro kailangan ng devices. Ano ba yung mga devices na kailangan natin? Very important is the thermometer and the pulse oximeter. As of now, yan ang talagang
True.
best friend nyo. So, pagka hot to touch, when you say hot to touch, pag nilagay mo yung opposite palm of your hand. Opposite hindi yung palm, the opposite.
Hindi
Kasi
ganon.
mas sensitive po
Ganon.
yung opposite yes. Pagka pinlace niyo po siya sa ulo at hot to touch, that's the time na magta-thermometer kayo to validate kung ano yung to validate. Kasi baka naman mamaya hot to touch, 36 lang pala siya or 37. Huwag po kayo magbibigay. Ang kailangan po ninyong gawin is bimpo, sponge bath. Yan. Pero pagka nakita nyo after 5 minutes, hindi bumababa, hindi nagre-respond sa sponge bath, that's the time na mag-thermometer kayo, mukhang tataas na yon after 5 minutes, tataas yun kung talagang fever. Pag napumalo yun ng 37.6, that's the time na bigyan nyo na po ng paracetamol. Ito po yung unang-unang lagi kong tinitingnan, doktora, pagka before magbibigay ng paracetamol at magpapababa ng fever. Tinitingnan ko kung pinagpapawisan ba yung bata or yung pasyente. Pagka hindi, magbigay na po kayo ng paracetamol kasi indication po ng hindi pagsusuwet ng isang tao ay nasa loob, ayaw lumabas ng fever. So, ano bang gagawin nyo pag hindi nagpapawis? Kailangan nyo bang para pagpawisin siya? Unang-una, walang humpay at dire-diretsong pag-unas po ng bimpo sa kanila.
I do that a lot. Sponge bath.
Ang temperature ng bimpo kasi yung mga matatanda po, ang binibigay nila ice cold. Naku po, wag po.
Ay, wag. No. Maligam-gam na tubig po.
Yes,
Yung
tap
tama lang.
water po. Actually, tap water is the best. Tapos, lagyan nyo ng konting alcohol para pag pinunasan nyo siya, yung
I do
sweat.
that too.
Yes. Tapos, saan nyo po ba pupunasan? Sa singit-singit. Sa singit ng kilikili, sa liig, sa singit ng tuhod, sa talampakan. Yan. Ano po ba ang wina-watch out natin sa fever? Ang pinaka-wina-watch out natin sa fever is kung malamig ang paa at hindi pantay ang temperature sa ulo. Bakit? This might cause, sa aming mga nurse, pagka ganun po, nag-ano na kami, na-alert na kami, kailangan pababain talaga yung lagnat, tapos nagta-39 na siya kasi pwede pong mag-convulsion yung pasyente kasi hindi siya pinagpapawisan. So, yun
Yeah,
po yung
yung
mga
kid, mostly
indication.
in kids. Oo.
Yes. In terms naman sa mga gamot na pang-ubo at sipon, ang kailangan natin is i-make sure na yung sipon, runny nose talaga. Kung barado lang po, magsuob na lang po kayo. Yun. Pagka naman po yung ubo,
Pwede naman.
dry naman po, plenty of water. Wag muna kayong magagamot kasi kawawa po yung kidney nyo kasi may sakit po kayo during that moment. Tapos iinuman ng gamot. Kawawa po si kidney. Ay, si
Oo,
liver pala,
tansyahin
sorry.
nyo naman. Kung wala namang problema, don't drink all of them at the same time. Tama si Ma'am
Yes.
Reyna.
Opo. Yun lang po yung mga aking advice sa
Observation.
nurse. Opo.
Thank you, Miss Reyna, for ito lang ang nurses po ang super magaling mag-sponge bath. Yung mga doktor sinalagay lang sponge bath, pero they actually never made a sponge bath in their life, except sa anak nila. So actually, a nurse would be the best person talaga. If you're doing a sponge bath, wag niyo po itapat sa electric fan yung tao. That's also not good. Patayin lang po. Should be a comfortable temperature po dyan sa bahay niyo. Okay? So let's do a few questions para we can guide the conversation po.
From Miss Arlene Esquivel, Doktora, ano pong masasabi niyo sa mga air purifier necklace? Man po o yung pangbahay, does it help po ba na laban po sa COVID virus?
Yung air purifier necklace, yun po yung tinatawag nating adjunct. Pandagdag lang. Pero really, what is important is the mask. Ngayon po, the double mask na kasi talagang parang the cloth mask, hindi na ho pwede. It should form a tight seal around your face. And yun po talaga would protect you. Again, face shields are optional. If you want to use a face shield, wala pong masama, no? So the air purifier necklace, after you're wearing all of those, then if somebody gave you for your birthday an air purifier necklace, edi isuot mo, wala naman hong masama. But you cannot walk around without a mask and expect po the air purifier to help you. So basically, ang dating po nito, kung may extra pera lang po kayo, wala pong masama. Yung sa bahay naman po, yes, they are selling HEPA filters, no? And these are used sa mga ORs. Pero yung sa bahay po, I would suggest you open the windows. Look at me, bukas yung bintana ko. And you spend time outdoors. Ngayon, kung may extra money, wala naman pong masama. But that is not the first step. Thank you for that question. Kasi maraming nagtatanong, sometimes the simpler, the better. Okay, next po. Thank you.
From Miss Dang Hurtada, good afternoon, Doc. Sana masagot po, pwede na po ba kami magpa-booster after na ma-COVID kami? Tapos na rin po ang isolation namin ng family ko. Salamat po sa sagot.
Sir, I'm very glad that everybody's okay. I'm glad na tapos na po yung isolation po ninyo. And yes, if everyone's feeling well, tapos na yung isolation, you may get a booster shot po. Good luck.
From Natividad Morong, Doktora, ano pong dapat gawin? Kasi po after kong magkalagnat nung New Year, gumaling naman po ako agad. Pero nung magkaroon ako ng contact sa COVID positive, hindi na nawawala yung hirap akong huminga. Kasi po may asthma ako. Hindi po ba masama yung pag nahihirapan akong huminga? Nagne-nebulizer ako?
Ma'am, if you are a known asthmatic po and you're having an asthma, ang tinatawag po nito in English, it's called asthma exacerbation or nagkakaroon po, naging active po yung asthma nyo, I would suggest you see your doctor. Kasi kung hindi na po kaya ng nebulizer, the Ventolin, I'm sure ginagamit nyo na rin yun. If you are a long-time asthmatic, it's time to get another consult kasi baka you need to start additional medications. If you got COVID prior, most likely, baka ito po ang tinatawag po nating long COVID. So again, I cannot tell you that, but you have to see your doctor po. By the way, wag po muna kayong lalabas if you're having a difficulty breathing. You just stay at home and recover first, okay?
Okay, from Mr. Arnie Ortiz, what are the best vitamin C for acidic person po? Thanks, Doc. God bless.
Some people are talking about kinds of vitamin C. Sa akin po, just the regular vitamin C is okay. Though I know there's some literature about types of vitamin C, hindi po ako ka-current doon. You may try po citrus fruits. Kung hindi naman po, kung kaya naman ng tiyan nyo, kasi I know that you're acidic, ano po, kung kaya ng tiyan nyo, you can try citrus fruits. Otherwise, ano po, calamansi juice, o kaya po, some people are saying na may ibang kinds of vitamin C, but I'm not aware. So sa akin, pareho lang yon. Though other people who are selling vitamin C might have others na other infos na madadagdag po dito.
From Mr. JRG Corvito, good afternoon po, Dr. Ana York. Ang galing niyo po. Ang galing niyo pong doktor. I love you. God bless po.
Wow! We love you too, and thank you for the kind words po.
From Miss Selena Sarmiento Hernandez, Doktor, ano pong gamot ng sintomas ng COVID? May ubot sipon po.
Ma'am, 'di ba po, we talk about it, the ubo, the cough medicine po, no? The sipon, you can try po the dextromethorphan kung barado. Sorry, the phenylephrine, no, kung barado. Or you can try mucolytics kung you want to get rid of the ano po, parang plema. Okay? Ano ho, after this, i-review nyo po itong video to. It is well explained in the beginning po. And you can buy this po na walang reseta, ha? But again, I always emphasize this. If you're not getting better, you need to call the doctor.
From Mr. Jumar Pukan, Doc, please elaborate to us mga mental health effect ng COVID.
Whoa, matindi nga rin po yan. Let's talk about the mental health effects po of isolation. Malungkot po talaga. And I think we discussed this, there's a video on mental health and isolation. Kasi talagang yung iba po nalulungkot talaga, no? Luckily, if you were isolated with your family, like 6 kayo doon, okay, masaya nga, nagde-Netflix lahat ng 6, ano? Pero there are some people po who will be isolated by themselves, and it can be really, parang isolating, parang lonely, malungkot. During this time po, I would advise you, if you're isolated, you can be physically isolated, pag wag naman pong emotionally and socially. Lots of people po tell them, I'm in isolation, send me food. Magpapadala po yan, and you can feel the love and concern po ng inyong pamilya and friends. You can also post po yung status nyo sa social media so that people po can greet you. Pero be careful about posting kasi meron din pong discrimination occurring. That's another issue po sa mental health. And meron pong, I hate to say that there are some people na imbes na tutulong, mag-chismis, and will say hurtful words. Sana po wag ganun, because we could be the next persons in isolation, and wag naman po sana. So those are a few of the mental health issues regarding isolation. Marami pa po. Please watch the video. And it was about 2 days ago po. So thanks for this question. Yes, in isolation, we are taking care of our physical health and our mental health din po dapat.
From Zarina Claire, good afternoon, Doc. How to address dry cough po?
Ma'am, try the cough suppressant. Ito lang kung nagpe-persist ang cough. There can be inflammation, namamaga ang atin pong bronchial passages. So, try to consult your doctor kasi po, kung talagang matagal na, they may consider inhaled steroids po na inhalers. So, kung early stage, try the cough suppressant. Later na hindi umaalis, call the doctor. May bibigay pong inhalers yung mga yan.
From Mr. JRG Corbito, good PM po, Dr. Ana York. Ano pong pwedeng gamot sa sipon? Kasi po, hindi makalabas, parang nasa tenga ko. Hina po ang pagrinig ko. Thank you po.
Ayan, yan ang mucolytic po ang tawag dyan. Kung baradong-barado po yung pakiramdam nyo. Na plema ha, try the mucolytic. Kung clogged nose naman ang problema nyo, try the phenylephrine and propanolamine. Yun po yung decongest. Feeling ko sa'yo, decongest. Okay. Ambroxol is a good generic. And again, if not getting better, alam nyo na ha, doctor.
From Miss Susana Rueda, good PM, Doktor. As po sana, nagkalagnat po kasi yung dalawang anak ko 1 week ago. And magaling na po sila. May vaccination rollout po kasi sa amin this week. Pwede na po ba sila magpa-vaccine ng COVID vaccine? After a week na gumaling na po sila. Salamat po and God bless po.
Ito po, after you finish, there's only two things. After you finish your isolation and you feel well na po, no, pabakuna na po kayo as soon as possible. Ngayon, kung may nararamdaman kayo kahit 10 days na po, 10 days na lang isolation ngayon. Kung may nararamdaman kayo kahit 10 days, you still should not go to the vaccine site. Like, umuubo ka pa, relax ka pa lang dyan. You might, pahabaan nyo po yung isolation nyo if you're still not, yung may nararamdaman pa. Okay?
From Miss Rosenda Farparan. Good afternoon po, Doc. Yung ubo ko po dito lang sa lalamunan, pero tuyot po. Ano po ba ang tamang gamot para inumin? Makati po sa lalamunan.
Ma'am, I would say po, lots of fluids, lots of juices. And then you may want to try a cough suppressant. Pero subukan nyo muna yung lots of water and lots of juices. Ay, Reina, please add lang For the sore throat, hindi ko nasabi. Okay? Povidone, iodine,
yes po.
gargle.
Opo.
Yan. Generic. For the sore throat, Povidone, iodine, o kaya yung yung Bactidol, pwede rin po yon. I hope I didn't mention a brand. But don't worry, hindi naman po ako bayad by any brand, so I guess I can mention anything.
From
Sige
Miss
po,
Marie
next
Flo
question.
PM po, Doktora, ask ko lang po, pwede na po bang mag-take ng vaccine booster ang naoperahan last November pa po?
Yes, ma'am, go. If you feel well, you can take po. Ayun po, the generic of Bactidol is hexetidine. Sore throat po yan. So, povidone, iodine, and hexetidine. Yun po yung pang sore throat. Let me type it, okay, for you guys. Sorry type lang po namin. Pasyensya na. I'm just typing for added knowledge po ng mga tao. Wait lang. Ito po. Sore throat itong lalabas, po. So, mga gargles po yan. Let's wait for a few seconds. Lalabas po. Miss Kat is typing that. So, nakalagay naman po how often, po. Just read it na lang po. Yan, povidone, iodine. There is a brand and there is generic. Okay?
Ayan po, hexetidine po. Ay, Doc,
Yan po. There's also a brand po dyan.
Yes po. Yung hexetidine, Doktora, kasi yung iba ginagawa nilang hobby ang gumargle ng gumargle every hour yata. And then, magrereklamo sila, wala na silang panlasa. Baka naman po kaka-hexetidine nyo po yun, kaya po kayo nawawalan ng panlasa.
It's from the gargles, too much gargles. Okay.
Opo. Kasi po madami po akong naging pasyente, kinakabahan, hala, wala na akong panlasa. Sabi ko, ano ba yung ginawa mo? Kasi gargle ako ng gargle ng hexetidine. Talaga pong mawawalan kayo ng panlasa kasi po, hindi naman talaga.
Too much gargling. Huwag naman. Just, hindi siya prevent. Some doctors are using it as preventive, Pero hindi naman, kung hindi ka naman doctor, there's no need to panic. Okay, guys? Kalma lang.
Yes po, kalma lang po. Sige po, next po. Next question po. from Miss
Marami pa
Bern.
ba? Let's make this our last.
Okay po, last question po. From Miss Bern
Do we have a
Ordonez.
lot? Wait, sandali. Do we have a lot of questions?
Super dami po ulit, Doktora. And we already have 112
Guys,
viewers po.
wait lang Can you screen the questions? Wag lang ulit-ulit yung mga tanong. Try to find something na unique.
Sige
Okay,
po.
anong dapat i-recommended pag suspected COVID? Mom, isolate yourself. And then according to the symptoms po na I spoke about. Okay, next po. Don't worry, gagaling ka rin. Lalo na kung bakunado. Paki-screen lang po yung questions para unique ng konti yung mga ano.
Tora, may nag-recommend na doktor before na kapag mataas ang lagnat, nakakatulong ang pag-eat right. Na-try ko po sa hobby ko na nilalagnat. Naging okay naman daw po ang pakiramdam.
What do you mean hydrate, ma'am? Ito ba yung sa ano? Sa diarrhea?
Doktora, para itong mga, yes, at saka parang ang ibig sabihin niya siguro yung mga Gatorade.
Hindi po. Ang paracetamol, ma'am. Don't try all sorts of things. Let's just stick with what is known. Pang ano ho yan eh, that's for rehydration. Ang ano po talaga, that's for rehydration. Kung ito lang sa bagay may point si ma'am. Ito lang, i-share ko yung point niya, okay? There are some people po whose presentation of COVID, and somebody just called me up over the weekend, nagtatae, okay? There is what we call gastrointestinal COVID. Maybe we should talk to Dr. June about this. Pero there's a subset of people na presentation po nila nagtatae. Say, yes ma'am, kung nagtatae po si hubby, or nagtatae po si anak. It's kind of common in kids eh. Pwede pong mag-hydrate. Hydrate po is a rehydration. You may also drink Gatorade po. But kung lagnat po talaga, it's not hydrate po. Paracetamol and sponge baths. And some people put this on their heads, okay? Paracetamol po talaga, ma'am.
Last question from Ms. Elizabeth Garcia Alano. Doktora, paano po yung pregnant na di gumagaling ang ubo? Ano pong pwede?
Ay, ma'am, thank you for this very, very excellent question. If you are pregnant, ma'am, do not stick around your house trying to take care of your ubo. Kung kayo po ay buntis, agad-agad pong tumawag na po kaagad sa OB. Call up your OB po, ma'am, and inform them that you're already coughing. Kayo po ay isang klase ng tao that they may wish to test early because po of the effects of COVID po sa bata. Especially po as different trimester, different pong effects. I'm also hoping that you're vaccinated kasi malaking bagay po yung vaccination sa mga buntis. So if you're pregnant, do not stick around with your ubo. Call your doctor kaagad. Very important. O sige, one more last question.
Okay, last question pa po ba, Doktora, or are we okay na po?
Let's do the last question since lumabas na rin. Malungkot naman
Sige
yung
po.
tao kung hindi babasahin. I-dwell lang kung ano yung point niya, ha? Hindi ko kaya yung habang ano.
Sige po, ako na
What
lang
is
po.
the question?
Yes, from Ms. Janine
Baka
Kiambao.
nagkakwentuhan lang si sir. O, sige, basahin na rin natin.
Sige po. Good afternoon po, Doc. Sunday po ng gabi, nagka-sore throat at nilagnat na ako. Hanggang Monday evening po, mataas ang lagnat, nag-chill po ako sa madaling araw. Tuesday, Wednesday afternoon, no fever na po, pero nag-umpisa na po akong ubuhin at sipunin. Wednesday night, nagkasinat po ako ulit, pero nawala rin po pagkainom ng paracetamol. Nag-mucolytic din po ako, pero hinintuan ko po, na po dahil naisip ko po ang dami ko na pong maintenance. Doktora, mukhang nagkukwento lang po siya.
Okay, good. Feel better po. Ma'am, ito lang kung marami kayong maintenance, that means marami kayong sakit, you may wish to talk to your doctor po. And if you are someone with plenty of maintenance gamots because of your diabetes, your dialysis, your asthma, your heart disease, you may be a candidate po for molnupiravir. Pakilagay lang po, molnupiravir again. If you're a senior, you are not vaccinated, marami po kayong sakit, or grumagrabe po yung situation nyo while under quarantine, please consider po to talk to your doctor and ask them po, if this gamot na naka-flash po, no, molnupiravir is good for you. The pricing, I wanted to add, pre-surge 2,000 lang daw yung 5 days. And then ngayon, surge na 3,000 daw sa NKI. 6,000 daw sa ibang ospital. At yung pinakamataas na narinig ko po is 8,000. Sana pumasok po yung ating DOH and FDA. Wag naman ho pag may surge, tataasan natin yung gamot. Hindi po tama yan. So to everyone, we went through the simple gamots po for COVID symptoms. COVID symptoms, ha, hindi to antiviral. So you can buy them over the counter, i-review nyo po at i-share nyo po itong video to sa lahat po ng triatrangkaso, na positive, isolation. Hindi naman po lahat ito kailangan nilang inumin, but at least they get an idea of what to do. Okay? So to everyone, enjoy your weekend. Please stay safe. Please wear a mask. Ingat po.